Dr. Jeff Hart from Highland Family Medicine is back with us. Good morning, doctor.
Good morning.
As you're well aware, Rochester Regional Health and the University of Rochester are recruiting participants for a phase 3 trial of a COVID-19 vaccine. All right, what does this involve?
So let's first look at what the phases of a vaccine trial are. So first there's phase 0, which is the initial development of the vaccine and then testing in non-human subjects, otherwise animals. Phase 1 is the first human testing phase. It involves trying the vaccine in up to 100 people, not very many, and seeing if it's effective and just if there's any major side effects. It usually takes a few months. Phase 2 looks more at effectiveness and safety, involves a couple hundred people, maybe up to 1,000, and usually takes months to years to complete. And phase 3, which we're talking about here, is a larger study involving thousands of people looking at effectiveness, side effects. It might compare the vaccine with other vaccines. Usually takes several years to complete.
Which vaccine is being tested here in Rochester?
So worldwide, there are 5 or 6 vaccines being tested right now. Rochester is one of the testing sites for the second vaccine that's been developed in the U.S. The goal is to test 30,000 people at 120 different sites throughout the U.S.
How will Rochesterians be used in this clinical trial?
Well, they're hoping to recruit about 200 Rochesterians to be involved, people aged 18 to 85 who are more at risk than others, so either due to exposure, ethnicity, or age for the most part. And they'll be vaccinated and then their symptoms will be followed for 2 years. And as you know, some of those people have already received vaccine.
What are the implications of having a vaccine available for general use?
Well, as I said, phase 3 would normally run for 2 years, but as you've heard, the United States and the rest of the world are on warp speed to develop vaccine. So, for example, one of the vaccines that's entered phase 3 right now didn't completely finish phase 2 before it entered phase 3, so they're kind of compressing the schedule. Dr. Fauci recently said that he's hopeful that there may be a vaccine developed in the U.S. by January. Now, what he means by that is there'd be a vaccine that's ready to manufacture. In order to really put it into general use, we'd have to manufacture 300 million copies and start administering them just in the U.S., not to mention the rest of the world. So the hope is by maybe a year from now, there'll be a vaccine that's in general use.
Is this cautiously optimistic? Is this a reasonable timetable in your mind?
Probably reasonable, depends on what happens with phase 3. And don't forget, there's another 4 or 5 vaccines in the world being developed, so there'll probably be several that are becoming available. But until there's a vaccine, our best defense is to keep on doing what we're doing now. So the vaccine will be great, but we still have to continue masking, physical distancing, hand hygiene, and disinfection. Those are our defense right now until a vaccine becomes available.
Well worth repeating. Doctor, thank you for your time.